Okay, it's recording. So my name is Deborah Soroka. I was diagnosed with multiple sclerosis 2 months ago, about 2 months ago. I have been having symptoms for about 3 years, but I did not know it was multiple sclerosis. The symptoms, they were very light, they were very subtle, and I couldn't really figure out what they were. But since they usually went away after a few weeks, I wouldn't mind them that much. But this summer, in the beginning of the summer, I had a very severe symptom in my views. Something that I've never felt before. I felt like I was dizzy. I literally felt like I was missing half of my leg. It was really weird to walk. I felt like I was gonna fall and pass out any second. It was just this weird feeling, and I was 100% conscious, but I felt like I was gonna just pass out and fall on the floor. My leg would burn, like there was like fire all over my leg. I couldn't feel my leg really well. I would touch my leg and it would just I couldn't feel it. And the pains in the head, not like normal headaches, but like really strange pain, feeling of tiredness. I just wanted to lay down in bed and stay there. And after having the symptoms, I went to the doctor. He said I was either stressed or I had MS. I really laughed at his face because I was like, I don't have MS. No one in my family has that, so why would I have? And I really, I didn't believe that it could even be possible for me to have that. So I went on the internet and I started to look into the symptoms, and I saw that I had most of the symptoms, and it was very probable that I would have this disease. And the one thing that really shocked me was that whenever I bowed my head like this, I would feel like a shock going down my spine. I don't know if other MS patients can relate to that, but it seems like it's a pretty common symptom. So after the MRI came back, I was really surprised when I came to know that I actually had MS. The result was positive. So my doctor sent me to a neurologist, and she later confirmed the diagnosis of the MRI and ordered an MRI of my spine, my cervical spine, and my lower spine to see if the lesions were affecting the spine. From what we've seen, all the lesions on the spine are inactive, even though they were there. There are some lesions there, but they're inactive. I have lesions in my brain mostly, and I think they're not extremely active. I'm not sure. I'm not sure the technical term, but yeah. So that's my diagnosis. And 2 weeks ago, I had an episode. I had a flare up. I I have never been so bad. I couldn't walk really well. I was like literally dragging my leg because I couldn't lift my leg. I couldn't lift my leg. I couldn't wear a shoe. I couldn't do anything with my leg, and my whole right leg was on fire as it has never been before. It was really bad. So I did a steroid shot, and it got better. It got better. Now my left leg is 80% better. I still feel a little bit weak on this leg. And on my right leg, um, it still burns a little bit. The soles of my foot, the sole of my foot. But I'm like, I would say 75-80% better. My head still hurts some. So this is my current situation right now. And the good news is that today I had my first consultation with a doctor that follows the Coimbra protocol. Okay, so usually the drugs for multiple sclerosis, they work, but they are very not effective. The drug that my doctor wanted to prescribe me is called Tecfidera. It seems like it reduces the flare-ups in 25%, and it helps a lot with the lesions in the brain. But that drug is an immunosuppressor, and it brings all your immune system down, not only the part that's causing the MS, you know. And it's something that you're gonna have to deal with forever if you decide to choose the traditional drug path, right? And this drug has so many symptoms, so many things that are negative about it, that if you drink it to solve the disease, you might end up with a disease that's worse than MS. Sincerely, like cancer. You know, it's a really strong drug. Very important decision to make if someone wants to start this drug. So I was my neurologist. She explained the connection between vitamin D and MS, and so I went on the internet to browse to kind of understand better this relationship, you know. And I found this doctor called Cícero Coimbra from Brazil. He treats MS with extremely high doses of vitamin D. Yeah. And this treatment has no side effects. Of course, you have to change some aspects of your lifestyle, change a little bit of your diet, start drinking more water, doing a little bit more exercise, but it's not something like drastic that's gonna cause you to develop a different disease. You know, so today was my first appointment, and I feel very excited. I received my list of supplements that I need to take. I received the dosage. I'm gonna be taking 80,000 units per day of vitamin D with a whole lot of water, 2.5 to 3 liters per day. Avoid any type of milk, any type of anything made with milk that contains milk, you know, is high in milk. Basically anything that has calcium, added calcium in it, I had to avoid, which is for me, comparing to the vision of actually having MS, that's nothing. To avoid milk and having MS, I'll prefer to avoid the milk and avoid anything related to calcium. No big deal. So yeah, I'm very excited. I received my first batch of exams, and I'll probably be concluding them this week or next week. I'm very excited. Thank you.